And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We're talking about a bunch of different topics around plastic surgery. We're also going to be posting the doctor's phone number later, so get ready to take that down. All right, Dr. Mele, we've talked about breast surgery revision, otoplasty, and now gynecomastia.
Gynecomastia, back to the breast.
Back to the breast. So what is it?
Literally means women's breast, but it's found on men where we don't usually want that. So it's an enlargement of the male breast.
Oh, so gynecomastia means male, basically. It's the male.
Or
no, it means female, but
yeah.
it's more for the...
Like the gynecologist.
Okay, I gotcha.
There you go.
All right.
But
so how does that happen in men?
If the breast tissue develops, it makes a bump.
Okay.
And if there's swelling, then a lot of times men are uncomfortable wearing a tight shirt,
right,
or certainly taking their shirt off.
Yeah.
Especially if it's uneven, if one side's bigger than the other. And there's kind of two types. The main types are true gynecomastia, which is development of the gland.
Okay.
Very common. Almost every male is born with it because of the estrogen from the mom. Usually in a few months it goes away. It tends to show up again at puberty.
Okay.
And about 65, about 2/3 of men get it. About half the time it goes away after a year or two. So if someone has it at 13, we kind of want to wait and see if it goes away. And then for the ones that persist, if it's bothersome, it's when we remove the gland. The other type is pseudo-gynecomastia, which is basically fat of the breast.
So, okay. And so that can happen if a patient is obese and maybe they lose a lot of weight. Can they have the hanging breast tissue that needs to go?
Sure.
Okay,
sure.
so that can happen.
Because when they gain weight, the fat gets bigger and the skin stretches out. And yeah, that's actually a little more challenging problem.
I bet, because there's a lot more skin, right?
Yeah, normally with gynecomastia, the skin's still tight.
Right.
And we're just unstuffing it and the skin takes care of itself. In cases where people have lost 150 pounds, sometimes the nipple and the skin are below the fold of the breast.
Oh, so we have to almost do a lift on that?
So we have to do a complete lift.
Wow.
And sometimes have to move the nipple up. And the difference between men and women, when we're moving the nipple, we want to leave it attached and keep the blood supply because we want to keep some mound. Men, we want it as flat as possible, so we tend to do a skin graft with the nipple rather than to leave it attached because it would leave a bump otherwise.
So what, I know you just told me the difference between female and male, but what's the downtime for something like that? Because it doesn't seem...
gynecomastia surgery? It's sore, like you did a bunch of push-ups, muscle ache kind of soreness.
So not a big deal.
Again, the first couple days, most sore. By the end of the week, we're friends again. And
okay, good.
things are working better. I do have my patients wear a garment, like a vest, for a couple weeks, day and night. And then maybe half the time for about 4 weeks after that.
So any alternatives to the surgery? Or
there's no drugs that work.
Okay.
And I know a lot of bodybuilders try them because I go online too and try to learn stuff.
Try to get that fat out.
But once it develops, it's very difficult to get it to reverse. It just doesn't seem to.
Okay, so mainly the surgery is just getting in there and liposucking
taking
it out?
What's extra. It's usually a combination of liposuction, works better for fatty tissue, and direct excision, which means making a little incision around the areola like we do for breast implants, just like from 4 to 8 o'clock, and directly removing the gland. And the difficulty is removing just enough, but not too much. If you take out too much, it's indented.
Yeah, exactly.
And that's worse.
All right, let's take a look at some pictures.
Okay.
Picture number 1.
So here's someone with, on TV it may be hard to tell, it's sort of very subtle. He has sort of pyramidal shaped nipples, so it's a very small amount of gynecomastia. It's only underneath the nipple and the areola, but it makes a sort of a triangular cone shape underneath, which is hard to hide in clothes.
Yeah, no, I can see that on the side there.
Sort of that side view you can get a little bit better. So afterwards the goal is just to get it flat. And you might think, oh, it's such a small area, it's a lot easier.
Yeah.
It's hard.
Is it really?
Because usually there's a little ring in there that wants to pull the skin together and cone it up. It depends on if you're hot or cold. If you're hot, the muscle relaxes, and we tend to see more of the gland. If you're cold, it tends to tighten up and look better.
So that's a tough one to do.
It's just,
get it just right.
Yeah, it's a matter of just paying attention to the details, being very meticulous with it.
That looks great, though. I mean,
he was very happy, and that's really the goal. So if he's happy, I'm happy.
Now this, you definitely
can tell. So a little
easier
to see I did something there. But same thing, I had to do liposuction. And then, in this case, I did liposuction first. And what I was left with was about a golf ball size of gland. So then I had to make the incision underneath the nipple, underneath the areola, and remove that tissue directly.
It looks like the areolas are smaller in the second picture.
Well, it's like removing an implant, taking away the stuffing so the skin shrinks up. In this case, I did nothing to make it smaller other than remove the gland behind it.
So everything kind of shrunk up.
That's a good point. Sometimes I have to reduce the amount of skin that's there too.
Yeah, I can imagine. So, but you didn't have to do that here?
No, and the advantage is then we just have the little incision underneath rather than all the way around.
Gotcha. It looks great. I can't even see the scarring. I mean, there's no scarring basically because you do it.
There's a scar, but it's right along the edge where the color changes, which makes it hard to see.
And then he would wear a garment around that until it healed?
So about 2 weeks, day and night, and then maybe half the time. And people can choose whether to wear it at night or during the day, whatever is more convenient for them.
You have a lot more men coming in and getting this surgery now?
Really common surgery, yeah.
It wasn't common before, but now people are coming and they want to look their best. Maybe it's summertime's
coming too.
There's a lot
of awareness. You know, some of the patients I did early were for bodybuilders, and they tend to network a little bit better, so that helps. But it's just people from all walks of life.
Wow.
And you can see the tremendous different ways it appears.
That's a huge difference.
So this is true gynecomastia. It's not fat, it's gland.
It's gland.
And in this case, I tried to do liposuction. It didn't help very much. Yeah. And I most of the time just removing a little bit at a time to make sure that what we're left with is smooth and looks good.
And you don't have to, I mean, when you take out the gland, I mean, you don't really have to mess around with the nipple movement at all. It just stays in the same place.
Yeah. So essentially, I'm just taking stuff out from behind the skin.
Okay.
So normally under the skin, there's about 1 centimeter of normal fat, and that's where the blood vessels are for the skin, so I really don't want to work on that. And then everything between that and the muscle, I will remove.
Do we have any more pictures on that?
There's another one. So again, just over projecting, over stuff. This is more pseudo gynecomastia.
Wow.
So a lot of times with just liposuction will take care of it.
Oh.
Pseudo means it's not as much the gland as it's just fat.
So it just,
And some people just have disproportionate fat in that area.
Okay.
Just like some people only have fat on their belly.
Yeah.
Some men only get fat on their chest. And
One
it's
more.
out of proportion.
One more picture.
And same thing. And again, none of these cases have I done any direct excision of the areola. They've all shrank just because of unstuffing. And this one's very discreet. You can see how the whole nipple looks puffy.
Yeah, very discreet. It does look puffy on that one side.
So in this case, no liposuction.
Didn't
need anything other than removing gland.
It's just, it shrinks everything down. That's fantastic.
And you can imagine any clothing that's kind of tight, it's going to show.
It's going to rub on the shirt, and that's going to be very, very uncomfortable.
And it can chafe the nipple, too.
Oh, that's not good.
Yeah, not good.
Yeah, so a lot more men coming in for this. In summertime, you probably see a lot more of these types of surgeries. Everybody wants to look their best.
And then around this time of year, people want to get ready for summer, so.
Yep, summer, the beach, whatever.
That way they're all healed up, ready to go.
It's all coming up. All right, thank you, Dr. Mele. For more information about Dr. Mele, you can call 925-943-6353 or check him out on the web, drmele.com or sanfranciscobreast.com. We have more coming up on Body Beautiful. Stay tuned.